Spinal cord injury, a drama-life version of spinal cord injury presented by Raymond and Daniel. Alright, let's talk hypotheticals. You know those moments when grabbing a really hot drink where all of a sudden your hand goes flying off that mug? Well, that's a sign that your reflexes are working perfectly. To avoid getting first-degree burns, our spinal cord and its extreme tricky wiring that run down our backs prevent these accidents from occurring. The spinal cord is a long thin bundle of nerve tissue that connects to our brainstem and is the highway for ultra-fast messaging. It's made up of essentially three sections: cervical, thoracic, and lumbar, controlling the superior, intermediary, and inferior sections of the body respectively. It's fundamentally important to play it safe when driving, gymming, and sporting, as with injury towards any of these divisions of the spinal cord, paralysis may ensue, with severity of damage to the body dependent on the strength and location of the spine itself. It does not discriminate. Well, I'm pretty sure you guys have seen at least one of those characters in a movie or TV show, laying in bed paralyzed, not able to move anything but their head. This is called quadriplegia. This is a spinal cord injury located in the cervical region between vertebrae C1 and C3, where no function can be maintained from the neck down. Injuries starting from the thoracic region are luckier, well, in a way, as they retain intact arm function. And last of all, injuries from T10 onwards, being least severe, allows the ability to walk with just minor assistance. Spinal injury is caused from a high impact blow, for example from a fall, forcing a bent or twisted spine, damaging the neurons, resulting with the inability to move nor feel parts of your body, depending on where you were hit. In general, the higher up the damage is located in the spinal cord, the more function you lose through your body, thus having a higher chance of quadriplegia. Within only a year, Australia had recorded 362 new cases of spinal cord injury from 2007 and 2008. Almost half of these were due to road accidents, many involving road users without any protective gear on, like cyclists, motorcyclists, and pedestrians. 28% from low and high-risk falls, mostly from sport and work-related incidences. People do stupid things, with young males being the most culpable, like Daniel and I, lol jokes. Our age group has a history of accidents that stem from outrageous levels of testosterone that pretty much blind us from any risk. Aid this with alcohol and you can only imagine the consequences. Believe it or not, the vast majority of unprotected road users were males at 92%, with a handful of them tested with drink driving. More than half of these incidences happened between 15 and 34-year-olds. Yeah, us. Autonomic dysreflexia is a clinical emergency where the spinal cord injury above T6 are affected. It is when the involuntary nervous system overstimulates without control from the brain, causing a sudden onset severe high blood pressure. Symptoms include throbbing headaches, sweating, nasal stiffness, flushing, slow heart rate, and anxiety. Autonomic dysreflexia requires immediate attention and it can be potentially life-threatening. Diagnosis and treatment of any traumatic experience relating to the spinal cord is imperative for preventing risk of further damage to the spine. This would otherwise be indicated by sharp back or neck pains. If these symptoms occur to you, a trip to the ER might best suit you. CT scans, X-rays, and MRIs provide visual aids used to spot any abnormalities with bone disconnections, vertebral degenerative changes, and identifying torn disc or blood clots that compress the spine. Post-emergency tests occur after most of the swelling subsides. A physician runs a neurological test to see the full extent of the damage for muscular strength, touch sensitivity, and reflex, for example the Dubinsky test. I believe most of you here haven't witnessed a spinal cord injury incident, but if you do and you are the closest help from that person, do not move or carry that person if he or she is not in any dangerous area. And when I say do not, I mean like really don't. Like seriously. This is because if you do move them around, there might be a chance of putting more pressure onto the site of injury. Like the commercial says, less is more. What you can do, however, is call up for help and let the paramedics handle the situation. And off to treatments. As painful as it gets, there is no cure to spinal cord injury at this point of time, as damaged neurons cannot be replaced or repaired. However, there are care and management programs for paralyzed patients, but it does cost a hefty $50,000 to $80,000 per person annually. If you have a dream car like me, that money could be very helpful. Therefore, you should be careful of yourself, as there's tons of cheap and easy tactics to prevent an SCI, which include seatbelts. It's the law, and most laws are said to promote safety. For people that go to the gym, proper form is fundamental for both maximum gain and for safety. For road users, seatbelts or helmets should be worn all the time. For people at work, make sure you slap on all your safety equipment if required to prevent throwing your back in. Alright, here it is. Being reckless is a gamble. Spinal injury is preventable. So don't go around being Rambo, cause spinal is a mother effing final. Yeah! That was bad. Alright, thank you guys for watching. Don't forget to subscribe. Alright, this isn't YouTube. Lol joke. See you guys later. Bye!